So I'm going to be talking about peripheral vascular disease and PEs. So just a little overview about peripheral vascular disease. It's a circulatory condition in which narrow blood vessels reduce the blood flow to the limbs. It can be arms and legs, but you mainly see it in the legs in older adults. PVD is a sign of fatty deposits and plaque building up in the walls of smaller arteries farther from the heart. So like the legs, and that is called arteriosclerosis. Symptoms of this may include leg pain, particularly when walking, cool skin in the affected limbs, loss of hair on the legs or the arms if the arms are affected, thinning of the skin on the legs or arms, and then also they're more prone to ulcers there. And then pulmonary embolism, a condition when one or more arteries in the lungs becomes blocked by a blood clot. Most times a PE is caused by blood clots that travel from the legs or can be other parts of the body, also known as a deep vein thrombosis or DVT. And then the symptoms of these can include confusion and apprehension, or like doom in older adults, shortness of breath, and then pneumonitis, which is inflammation of just like the lung tissue. And so that's kind of where this shortness of breath comes into. And then older adults may not experience the typical chest pain that younger adults would feel because of their altered pain sensations. So it's mainly just confusion and apprehension are the most common symptoms for PEs. So for safety and infection control, we want to protect the patient from any injury. So just making sure every time we go in there, if they have a PE or a PVD, the call lights in reach, the bed alarms on, non-slip socks, SCDs, and compression stockings. This will just help with the circulation and the poor perfusion that they have in their legs. Participate in emergency planning and response. If the patient cannot breathe and has a suspected PE, give them oxygen, call a response team, assess vitals, and then they may need surgery or treatment for that PE. And then educate them on safety issues. You want no pillows underneath the knees. This can not only cause pressure injuries, but also decrease the blood flow to the legs when they already have that problem. And then have them give us a call when they need to get out of bed because they're a fall risk due to numbness and tingling that can occur because of poor circulation. And then health promotion and maintenance. So we're going to assess and educate them about the health risks. So for peripheral vascular disease, the health risk is going to be age. Older adults are more prone. If you have a family history, diabetes, smoking, hypertension, high cholesterol, and obesity. These things all block the arteries and narrow them, and so that prevents the blood from flowing to all the limbs. And then PEs, age, history of clots, immobilization, so if they're not getting up and moving every so often, malnutrition, CHF, arrhythmias, and then the book also said a fractured hip. I'm assuming that's just because they're immobile and recent surgery, correct? And then educating them about preventative care and health maintenance. For both of these, you want to just make sure that they get a balanced diet, exercise regularly, walking is great, smoking cessation, maintain a healthy weight, wear compression stockings when they can, and then avoid crossing the legs, especially if they're sitting for long periods of time. That'll also just decrease the blood flow to the legs. And then we can perform screening assessments for both of these. So for peripheral vascular disease, it's going to be an ultrasound, which can show the arteries if they're more narrow or blocked, and then blood tests, which will check for like high cholesterol and triglycerides, which if they have elevated cholesterol or triglycerides, that will lead to narrowed or blocked arteries. And then for PEs, angiograms, these just take a picture of the heart pumping blood and show any defective arteries. A lung scan can show how the blood moves within the lungs and how that's flowing. And then D-dimer, the lab will tell you if there's a presence of a clot or not, just not the location of where it is. Psychosocial integrity, so we want to assess the patient's ability to cope with life changes with these diseases and then make sure they have support. as patients age, they become less independent, and so if they have a PE, they might require oxygen as well as assistive devices. Just getting around and walking might be harder for them with these because of the numbness in the legs from PVD, so they might need a walker or cane, so making sure that they have access to that, know how to use those correctly, things like that. Assess the support system to aid in care, determine if they live alone or has anyone to check in on them. As patients age, it's harder for them to live alone just because they're at a greater chance for a fall risk already, and then especially with these diseases, and so just making sure that they have a support system and they're not home alone all the time. And then if not, provide resources for like in-home health support, someone coming in checking on them and making sure they're doing okay, and then or providing options for independent living facilities, so maybe they're on site somewhere but they're mainly independent. And then recognize nonverbal cues to stressors, just assessing their facial expressions and their body movements when we're giving education and telling them about this or these diseases, making sure they're understanding it and coping with that. So for basic care and comfort, we want to assist the patient to compensate for any physical or sensory impairment. And so just educating them, especially with peripheral vascular disease, wearing shoes that fit, removing clutter from the room and on the floor, and then using a walker or cane to get around, just because it's going to be harder for them. And that's a picture of what their legs can look like, the thinner skin and the discoloration down there. And then perform skin assessments and implement measures to maintain skin integrity is especially important with PVD. We want to assess the affected limbs, legs and arms for skin breakdown, cap refill, color, temp, abnormal changes, and checking the pulses too as well. And then implement measures to promote circulation. This would be educating them on like exercising and walking, doing a couple laps, getting up, walking around their house every hour, so just to keep that blood flowing. And then again, compression stockings, SEDs, and then elevating the feet and then dangling them also help with the blood flow. Assess for pain and interventions. With a PE, they might need bed rest, or suspected PE, they might be put on bed rest because too much movement could dislodge the clot and then create a PE. If they're in pain, just get them comfortable, upright position, give O2 if needed, and then PRN pain meds. And then we want to evaluate their nutritional status, a well-balanced diet with low fat, and then low sugar intake as well will help not clog the arteries. And then make sure that they are hydrating, because hydrating in fluids helps with circulation. And then for pharmacology, so for PEs, we have the anticoagulants, which are blood thinners, and these will just prevent the clots from getting bigger and new ones from forming. So we've kind of talked about all of those down below: heparin, warfarin, Lovenox, Eliquis, and Xarelto. And then also the thrombolytic therapy or clot buster, and that dissolves the clot. And then for PVD, cholesterol drugs, which are statins, and this helps lower bad cholesterol and then reduce the plaque buildup if they do have it. And those are some examples there. And then I said also anticoagulants for PVD, and that will just prevent the blood from clotting. And they listed clopidogrel and aspirin for those. So just making sure that they know the risks for the medications, for the blood thinners, monitoring for new bruising or unusual bleeding and things like that. And with PVD, their skin is already thin, and so just making sure we emphasize, watch where you're walking, closed-toed shoes, stuff like that, to prevent cuts and falls and stuff like that, especially when they're on the blood thinners. And then we can titrate the dose of medication based on the orders, so watching their blood or clotting labs and making sure that we're not giving them too much or too little. And then other treatments listed for PVD is an angioplasty, surgical procedure that inserts a catheter into the artery to create a larger opening, and this is with like a balloon or a stent. And then they can also do bypass surgery, which a surgeon creates a path around the blocked artery that they have using another blood vessel from another part of the body or a synthetic one. And then for PEs, just embolectomies, removing the clot. And we want to reduce the risk for potential injury, and by assessing and responding to their changes in vitals. So with PEs, again, providing oxygen if they're having trouble breathing, and then elevating the head of the bed to try to relieve any of the shortness of breath they may have. For PVDs, we want to maintain and apply devices used to promote venous return, so ensuring that they have the SCDs on their compression stockings at all times, and then this will help improve circulation. And if they don't have a clot but they're on bed rest, these will help prevent clot formation if they're not up walking around. Evaluate the response to treatments, continuously monitoring clotting labs, kind of like I said with the blood thinners, and then adjusting those as needed. And then the same thing, monitor for unusual signs of bleeding, take bleeding precautions, especially with thin skin, educating them about soft toothbrushes and razors, and then perform focus assessments for PVD, skin assessment, and document any changes from their baseline, making sure that it's not getting better, or not getting worse, that we're getting better or maintaining it. And then for PE, respiratory assessment. And then I have some questions. What do you guys think?
B?
Yep. And then there's one other one. Not A.
D?
Yep. So A, they shouldn't put their foot in first. Just with PVD, they have decreased sensation, and so might be scalding hot. And then we want to keep them walking. And then for cholesterol, if they're on a medication, you want them to take it every single day, not just every other day. And then D, because of the decreased blood flow and poor perfusion, their leg hair doesn't grow as fast, so it's minimal. Number 2.
A?
So we don't want to use a heating pad just because it can get too hot on the skin, and they wouldn't be able to feel it as well. And then 3.
I don't want to say all of them.
A,
C, and D?
All of them, yes, all of them except B. So indicate sufficient perfusion would be all of them except B. And that's it.
Don't log out of it totally, yeah, because I want to go through some stuff. So your peripheral vascular disease can be arterial or venous, right? So we're talking shiny, no hair growth, that is your arterial. Then if you get into your brown, that ruddy color, that's usually venous. But when in my brain, with all the tutoring I've been doing for NCLEX, I really think that you can kind of place mentally peripheral vascular disease and diabetes in the same column. They have those same issues, that decrease in sensation, that increased risk for injuries, the wounds, the chronic ulcers that won't heal, the swelling. I think with a lot of times with the peripheral vascular disease, you're looking at CHF is going to be a huge factor in there too. The PEs, your slide was perfect. I might have added the word CT. So when it says lung scan, they're talking about a CT. And I find it very interesting, like in my life, the 2 different times I've taken my husband in for prolonged hospitalizations, they immediately took him for a CT, and neither time did he have one. Now, if you guys remember right, he developed one. But they see that shortness of breath, they are whisking them off to CT, because they know that early intervention, early meds are critical. It depends on the size of the PE. His didn't cause him any issues other than his brief, a little dyspnea when he got to the bathroom. For other people, it could have taken him out, just depending on the size of the PE. Very testable stuff, very, like, this just needs to be, this should just come easily to you. This is stuff that you have been, you've been touching on this since 310, really. Nice job.
Thank you, Hannah.
Yes.